dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today my guest via Skype is Peggy Huddleston. Peggy is a psychotherapist and the author of Prepare for Surgery, Heal Faster, a guide of mind-body techniques. She developed 5 steps to prepare for surgery and trains healthcare professionals to use them. A graduate of Harvard Divinity School, her writing and clinical work focus on the way emotions and the human spirit enhance healing. Welcome, Peggy.
Thank you, Yvonne.
Tell us a little bit about how Prepare for Surgery helps people facing surgery.
Well, it gives them 5 steps to follow using mind-body techniques. It shows them how to reduce anxiety. We found that in using it, they actually use 60% less pain medication following surgery. And they also connect with a deep inner peace they've never felt before. And they also heal faster. So it helps the patient facing surgery and helps the hospital because it saves them money when they have happier patients. Their patient satisfaction scores soar and they get bigger reimbursements from the government. So it helps everyone.
Well, most important, better outcome for the patient, correct?
That's most important.
Most important. Can you describe the 5 steps?
Yes, the first step is using my relaxation CD, or they can use it as an MP3 file, and they listen to it twice a day is best for about 25 minutes. It gets them deeply relaxed, and it shifts them out of anxiety. And then as they're deeply relaxed and they go, oh, I feel like myself again, then it asks them to think of a person or pet who's easy to love, and that shifts them into their heart. And our heart creates a field of energy that surrounds our entire body and places every cell in peace and harmony. So Yvonne, it shifts them out of the fight or flight response into feeling peaceful, and that's a state where healing is accelerated. And then as they're deeply relaxed, they then have access to their unconscious mind, and in that state, they imagine their best friend or family member coming into the hospital saying, how do you feel? And they're saying, I feel comfortable, I'm so glad you're here. Then they imagine recovering well at home, and then if they had a knee joint replacement, being back skiing again or walking on the beach. So they imagine their 3 end results, and as they do that, it gets into their unconscious mind, and that's what speeds the healing.
And what about the healing statements and working with their anesthesiologist?
Well, it's a page they cut out of the book, and it's 3 statements they ask the anesthesiologist, would you or a nurse in the operating room say these to me during surgery? And when a person's deeply anesthetized, their person's highly suggestible, like in hypnosis. And the statements go right into their unconscious mind. The first one that's said is, following this operation, you will, I can't even remember my own healing statement. Following this operation, you will feel comfortable and heal very well. And they say it 5 times. As a result, they heal faster. And towards the end of surgery, they say, your operation is going very well, and they'll say you'll be hungry for, and they may say chicken soup, whatever the patient has filled in. And it makes the patient in the recovery room be hungry instead of nauseated. So if they're hungry for chicken soup, there's no way they're going to have any nausea or vomiting happening. So that's the purpose
of the healing statements. That's terrific.
Yeah, and it gets a faster return of bladder and bowel function. At Brigham and Women's Hospital in Boston, where they use it, the nurses in the recovery room have told me patients using the program leave the hospital 3 hours sooner than patients not using it because their vital signs are stable sooner.
Interesting. Now, I know that you have a particular video you'd like us to share with our audience. Explain it a little bit, and then we'll show it to them.
Yes, it's a video of a patient using this at Kaiser Permanente Santa Clara Medical Center. Kaiser's the largest HMO in the country. And they had me train 20 nurses there and giving the program. And you'll see the patient going through being anxious, using the program. You'll see the anesthesiologist who brought the program to the hospital. And then you'll see him afterwards telling you how calm he felt and how much faster he healed.
Okay, well, we're going to take that moment right now to give our audience the ability to see this video.
We're off to the frontiers of mind, body, spirit medicine.
Healing Quest explores all this and more right now.
Join us on the journey. Art Hall is getting ready for surgery. He's expecting to get the best of modern medicine at this Kaiser hospital in California's Silicon Valley. But he's also doing more.
All right, good luck.
Thanks for the ride.
I'll be praying for you. Yeah?
Thank you.
All right.
He's using a new technique that taps into the power of the mind to help the body heal faster. The technique was developed by Dr. Peggy Huddleston, a psychotherapist from Cambridge, Massachusetts.
When you take the best of modern scientific technology and you have the patient participating in their healing process with their emotions and their soul, you have much better surgical outcomes.
A key goal of Huddleston's program is to help patients overcome the anxiety that comes with facing surgery. The first step is using a relaxation tape in the days and hours leading up to the operation.
Research shows that when a person is deeply relaxed, just 20 minutes of deep relaxation increases their T cell levels. Our T cells are the coordinators of our entire immune system. So just having a relaxed patient means you have a patient whose immune system is much stronger.
The second step is having patients visualize their own healing. In Art's case, it was visualizing the successful completion of an important business trip that was scheduled within weeks of the operation.
Step 3 is organizing a support group and asking your friends and family to wrap you in a blanket of love for the half hour before surgery.
Jackie Cathcart is part of Art's support group.
I think that mind and body do work together. I think miracles happen. I think anything's possible.
Step 4 is meeting the anesthesiologist several days before the surgery to resolve any questions and build rapport. And the final step is formulating healing statements the operating team will say as the procedure begins. Art Hall's operation this day is to repair a hernia.
My hope and expectation is that I'll be relaxed going into surgery and that I'll have a positive outcome in the recovery room. I had surgery about 20 years ago and was very ill and very nauseous, and so I have a positive feeling that that's not going to happen this time.
Research indicates that Peggy's method cuts the use of pain medication by up to 50% and drastically reduces nausea. One study showed that abdominal surgery patients left the hospital a day and a half earlier than those who did not use the program.
And after the operation, you're going to feel very comfortable and you're going to feel very well.
Art, following this operation, you're going to be very comfortable and you'll feel very well.
After using Dr. Huddleston's program for only 6 months, the administrators here say they've seen big changes in their patient satisfaction surveys.
We not only saw our scores go up significantly, but they were higher than the other hospitals in our region. The range was from approximately 8 to 12 percentage points in each category, which is a huge change. We've never seen any more than 4 percentage point change in any category.
Dr. Annette Chavez has experienced the program from both sides of the operating table, first as a surgeon and then as a patient when she broke her ankle.
I used the program the 12 or 24 hours prior to my operation, and the thing that I found more than anything else was that the pain control was easily remedied, in that I only used pain medications for 3 days after an open ankle procedure.
For Art Hall, the program also worked well.
I remember being on the table and talking to Jean and feeling relaxed. And then she asked me, how did I feel? And I could feel relaxed. And then she said, that I could remember her saying the affirming statements 3 or 4 times. And that's the last I remember.
Art's stay in the recovery room was also easy.
I don't feel groggy or dopey. I don't feel nauseous. And I woke up quickly. There wasn't a long phase of feeling incoherent or anything. So it was like waking up from a nap or something.
Dr. Huddleston's program is being used so far in 5 states in the U.S. and in England, Holland, and France. She says the increasing use of the program is heartening, but she says what's most rewarding is giving patients a chance to be more deeply involved in their own healing.
Patients want to do everything they can emotionally and spiritually, along with the best technology of surgery that will enhance their healing. And there's an enormous amount that they can do to influence that. Following this operation, you will feel comfortable and heal very well.
Now that you've seen the video, I hope that was very helpful for you. Peggy, tell us a little bit about the research that's been done related to this.
Yes, I did a study at the New England Baptist Hospital in Boston with Dr. Ben Bierbaum when he was the former chief of orthopedic surgery. And I did the study with 42 patients having total knee joint replacement. And we found that when patients listened to the relaxation CD twice a day for 2 weeks before surgery and read the book, that they actually healed faster. They were discharged from the Baptist 1.3 days sooner than the control group. And that's a big cost savings for the hospital, but it means you have a much happier patient because they're healing faster. And then at the Leahy Clinic in Burlington, Massachusetts, they did a study with patients using this for colorectal surgery. They found that patients using it also had significantly less anxiety before surgery. They also healed faster. They left the hospital 1.6 days sooner. And they, by the second day at home, they were using 60% less pain medication. And they also had significantly less insomnia, depression, irritability, and a huge increase in patient satisfaction. And then the third study that I did with the chief of medicine at Beth Israel Deaconess Medical Center, Dr. Russ Phillips. And he had seen how much this was helping patients who were having surgery. And he said, but what about patients who are hospitalized, who have a lot of anxiety? Could this be used to reduce their anxiety? So they picked patients who, actually many of them had just been in the hospital for reoccurrence of cancer. So they're a very anxious group. And they listened to the relaxation CD with their own positive outcomes. They took what they worried about and turned them into positive healing imagery. And just using this twice a day for 25 minutes, they used less anxiety medication. They had a reduction in anxiety and had a significant reduction in heart rate. And that was published in the Journal of Alternative and Complementary Medicine.
That's fantastic. How about with people having chemotherapy? How might this help them?
Well, there's a chapter in my book on how to reduce the side effects of chemo. The first thing they have to do, Yvonne, is they have to begin to see the chemo as 100% healing. There's a fascinating study that was done where they gave people who thought they were having chemo, half of the group got a sugar pill, a placebo, and the other half, a negative placebo. They thought it was chemo, and the other half had chemo. 30% of the people who were given the sugar pill who didn't even have chemo lost their hair. So it documents the power of beliefs. They were that powerful with their beliefs because they believed if I have chemo, I'm going to lose my hair. And 30% did, and all they had was a sugar pill. So it's so important that a person first learn to get deeply relaxed, because when you're relaxed, your immune system is strong and vigorous. Most people who have a diagnosis of cancer, for 3 or 4 years before have been extremely stressed, and that suppresses the function of your immune system. A healthy immune system, the natural killer cells cruise around 5 cancer cells, engulf them, and get rid of them. If you're depressed, your immune system's not working very well.
Where in the country do they offer your program?
A number of hospitals around the country. For example, in Boston, at Brigham and Women's Hospital, they've been offering it there for about 8 years to patients. In New Hampshire, in Nashua, St. Joseph Hospital, in Hartford Hospital, St. Francis Hospital Medical Center, NYU Medical Center, Kaiser. There are a whole bunch of hospitals all over the country offering it, and people don't have to get it through their hospital. They can just, get the book and CD or the MP3 from Amazon in one day, or the book's website.
And the website would be what?
It's healfaster.com.
And how,
HEALFASTER.
Okay, and how would this help children?
Well, it's for children. If they're preparing for surgery, what you do is you prepare the parents, because if you have calm parents, then you automatically have a calm young child, because children learn to worry. So if their parents have learned to not get anxious about their child having surgery and using the 5 steps in my program, you'll have very calm children because their parents are not freaking out.
Peggy, how did you come about this program? Was it something that you used for yourself when going through surgery?
I was working with a bunch of clients, and suddenly in a cluster of 3 weeks, I had many clients who were all facing surgery and were highly anxious and said, what can I do? And so I came up with these 5 steps, and as they used them, they came back and say, I've learned to sleep again. I can shift myself out of the anxiety. And they tell me after surgery, my surgeon said there's actually much less bleeding in the operating room. That's because they were so relaxed. And they said, and my surgeon said, I've healed faster. The scar actually healed faster than they've ever seen. They said, you've got to put this in a book. So that's where it came from, trying to help patients.
And how receptive have doctors been and the surgeons if an individual goes to their doctor and says to them, I would like you to make sure that these healing statements are said upon my surgery, and to have and support me in a very positive way as I go through this journey of surgery?
Surgeons want to have happy patients, and they know they're willing to do anything that seems reasonable to patients requesting. And the surgeon doesn't have to say the healing statements. The anesthesiologist can do them, or a nurse in the operating room. So surgeons love it because they have happier patients who are going to refer their friends.
And what are the things that you would recommend that people bring to their doctor in order to have and start this conversation about readying them and preparing them for surgery?
Well, I say they could just print off from the book's website the research, because doctors say, what's the research? Or they can print the brochure from Brigham and Women's Hospital, Harvard Teaching Hospital, that's on the book's homepage, and say they use this at a Harvard Teaching Hospital. This is what I'm doing. And for them also to know they don't need their surgeon's permission. Right. They just need to be saying, this is what I'm doing. They need to be an empowered patient to say, by the way, I'm going to be using these mind-body techniques, and it's going to help me get very peaceful before surgery. And the research shows it's going to help me heal faster. Have you heard about it? If they say no, said, well, you'll get to see the results. So they don't need permission.
That's important to say. If anything, you want to empower people to be able to move forward in this positive way.
Exactly.
So now let's talk about after surgery, helping them related to not only their statements, but their mindset in helping them to heal quicker, as well as to move forward in their life in a very positive way. What would you recommend to people?
Well, Yvonne, they want to keep listening to the relaxation CD or MP3 at least twice a day, all during the recovery. And what I found most moving about this is people listen to it over and over again for a number of days or weeks. They say, I've connected to an inner peace I've never felt before. This has changed my life. And so the penny will drop, and they'll say, oh, it isn't just for preparing for surgery and reducing my anxiety or healing faster after surgery. This actually helps me connect with an inner peace, and they keep using it.
How long does the CD last?
Each track is 25 minutes, and they have 3 tracks on the CD.
So
people.
Go ahead. I'm sorry.
Many people use it to fall asleep. They'll find out by accident if they've got insomnia, they'll start listening to it during the day to get relaxed, And they're so tired they fall asleep, and then they realize, ooh, I could put this on at night when I want to go to sleep, or when I want to go back to sleep in the middle of the night. And so they'll just put on the third track, and they'll get deeply relaxed and just fall asleep, and they'll start saying, oh, I can finally sleep again.
So do they need to listen to all 3 tracks at the same time and allot 75 minutes, or can they listen to 1, 2, or 3?
Just 1 track twice a day. So it's 25 minutes twice a day will do it. And some people only listen once a day. Others will only find out about it, maybe have 2 days notice before surgery. Even 2 days of using it can help them tremendously. But it's better if they have 2 weeks, because then they really reduce their anxiety and set their body up for optimal healing.
And what vitamins or foods that people can eat that can help enhance their healing after surgery?
Well, there's so much research showing that vitamin C, taking it up to what they call bowel tolerance, is the best because it dramatically speeds healing. And then also bromelain, which is from a pineapple stem. You can get this at any health food store. To take it after surgery, it reduces bruising and black and bluing, is really great. But they need to carefully go over with their doctor what vitamins they're taking, because some, like vitamin E, should be stopped a few days before surgery because it promotes bleeding.
And if somebody has a chronic health condition, how might this program help them?
Well, it will help them a lot because along with obviously working with their physician, allopathic medicine says that 90% of illness now is caused by stress. And so as they use the relaxation to get deeply relaxed and be in that deeply relaxed state and not be feeling stressed, they give their body a chance to heal.
So it's important, you were saying before, for people to understand that they don't have to go to a hospital-oriented program in order to prepare for surgery and utilize your techniques.
No, you're right. They just have to get the book and the relaxation CD, and if they need it right away, they can download it as an ebook in 1 minute. And the MP3 is on the book's website, so they can get that downloaded into their email in 1 minute.
Very good. And from a device point of view, when they go and use it in the hospital or take it anywhere, do they need a certain device to play it on?
Well, it's best if they have it on an iPod or an MP3 player. It's better not to have it on a cell phone because they won't let you take that into the operating room because they want to listen to the relaxation all during surgery because it blocks out the things they're saying in the operating room. In the OR, they're just talking about the latest football game or what's going on, and it's not great for patients to hear that. And so having those earbuds in of listening to the relaxation blocks that. The nurse will take out the earbuds when they say the healing statements.
And do they need particular permission in order to bring that in to the OR?
At most hospitals, they don't. Some hospitals, they may, and the person they'll ask will be the Director of Surgical Services. So they'll also want to check with the Director of Surgical Services saying, I'm going to be listening to an iPod or an MP3 player during surgery. They use these at Harvard teaching hospitals. In the operating room, it's perfectly safe, but I'd like your permission so I know I can bring it in.
Very good. So let's summarize the most important things that you want people to know about your program and what it can do to help them.
Well, if anyone's facing surgery, it can shift them out of anxiety. It gives them the tools to get deeply relaxed and to take each worry and turn it into a positive healing statement. And as they do this, in about 1 to 2 days, they'll shift from being very anxious to being deeply peaceful. And then also my favorite step is asking their friends to think of them for the half hour before surgery, that specific half hour, and wherever their friends are in the world, the same half hour to wrap them in a blanket of love. They'll feel this wonderful peace wrap around them as they're waiting for surgery. And I'd say there's so much they can do to transform it, and they're going to heal much faster. It doesn't matter if they're facing a mastectomy or a lumpectomy, and they have 2 days' notice. This still will give them the deep peace, and that peace is something that's already there. It's the peace of their soul, and they're learning to get deeply relaxed to connect with that inner peace that's just there.
And it's so very important. And as far as reaching out to their doctors to say, this is what I want to do, what do you recommend that they bring with them when they have their appointment, or call the office with the information?
I would say don't even think you have to ask your doctor's permission. You just talk to the anesthesiologist. You'll meet that person 20 minutes before surgery. You have the page of healing statements you cut out of the book and say, I'd like you or a nurse in the operating room to say these to me. If the anesthesiologist says, well, great, I'll get a nurse, then say, I want to talk to her or him. Look them in the eye and say, these are the healing statements I'd like you to say, and I know it's my legal right to request them.
And they should probably bring a safety pin or whatever so they can attach it to them, right? So they don't lose them?
Well, probably Scotch tape them. They don't allow safety pins in the operating room. They think they're dangerous.
All right, then. So Scotch tape. And so they can just come right then and there. So you're saying the day of surgery and bring it in. But the only thing that you said that they would want to check is related to bringing their iPod. And who would they check that with?
Well, the director, they could call the pre-admissions and say, I'm going to be listening to a relaxation all during surgery. I want to make sure this is routine at your hospital. And I'm listening to it on an iPod or an MP3 player. And they will say, sure, we do this all the time. Or they can say, if they say, gee, we don't know, say, well, connect me to the Director of Surgical Services. I'd like that permission to do it. And if the Director of Surgical Services can't say yes, then you'd have to call your surgeon's office and say, can you arrange this? The surgeon can get them to say, yes, we'll do it.
And they can purchase your book on Amazon, you said, as well as on your site, which is what?
It's healfaster.com. And plus, there's all kinds of research and information that will help them.
That's excellent. Peggy, it's been such a pleasure to have you with us, and it's so empowering for people to know that they have this option to use. I wish you a wonderful day, and thank you again for all that you do. Take care. Until next time.
Thank you, Yvonne. Bye.
Bye.